I am here representing the group on Centres of Expertise in European Reference Networks, and I think it's important to say that that's an area that's quite broad and cross-cuts a lot of the other areas. So the workshops today will probably have a little bit of relevance for centres of expertise right across the board. So I think we'll be talking about this in general. So I just wanted to give you just a little bit of a background. It's estimated that between 6 and 8% of the Irish population, which is up to 280,000, we reckon, Irish citizens will be affected by a rare disease in their lifetimes. And about 250 million people worldwide will be affected. And as we always say, it's not rare to have a rare disorder. Rare disease patients feel marginalised in the classic healthcare system and face unequal obstacles for funding and resources, while a major information deficit appears to exist with health professionals themselves in getting the information. So patients with conditions that are catered for within the actual traditional systems and have had access to centres of expertise and European reference networks have much better results and much better experiences, and that's something that we want to replicate for people with rare diseases. So the vision of our subgroup was to develop networks for the provision of equity and safe care to all patients with rare diseases in Ireland, whether provided from a recognised national centre of expertise or by linkage through the patient healthcare provider to recognised European reference networks, or ERNs. I'm conscious there's lots of little words that we've some guidelines, and hopefully we'll have more understanding of these towards the end of the day. So what we needed to do was to comply with the 2009 recommendations on the joint action. And so to do that, we need to designate centres of expertise and contribute to the European reference networks. So centres of expertise and ERNs are key tools to tackle conditions requiring specific care, bringing together multidisciplinary competencies, including paramedical and social services to serve the diagnostic, treatment, rehabilitation and palliative care needs of rare disease patients, and improving care by addressing an organisation of a healthcare pathway. And it was good to hear the Minister speak about that earlier at national and European level. We have to be aware of the fact that with such a lack of expertise and a lack of patience, we do need to work at a European level in this area. Organisations of collaboration to ensure a continuity of care from childhood through to adolescence and through to adulthood and between all stages of disease is very important. And as Anne Lawler from 22Q will always say, children grow up, they don't grow out of conditions, and we have to ensure that their whole healthcare is managed throughout their lifetimes. And networking with European reference networks we feel will be very helpful, because we do expect the implementation of the cross-border healthcare directive, so that should help with that whole activity. And capacity to participate in data collection for clinical research and for public health purposes is also something that's very important, particularly in the area of clinical trials, and I know Helen has already referred to that. So we need to produce also and adhere to good practices and guidelines for diagnosis and care, including national and European legal provisions, and implement quality standards as recommended by EUCERD. And EUCERD is the European Committee of Experts on Rare Diseases. All 17 member states have representatives on that committee through patients, industry, policymakers and research, and John Devlin is our Irish representative on that. So one thing really that came up and kept coming up within the steering group is the issue of a central point of information, and this was really cited as something that's essential. A lot of work has been going on, even though we're discussing, a lot of work is going on in the background in these areas, and Gerdo launched a study before Chris's survey just to kind of get a feel for what people are feeling in this area. And we discovered that 13.3% of patients waited over 10 years for a diagnosis, and 37.2% received an initial incorrect diagnosis. The experience of patients and their families on the path to diagnosis raises concerns about the level of awareness of rare conditions among healthcare professionals particularly, and the information gap that is causing delays in diagnosis and of course huge distress. Currently in Ireland, there is no central point of information at all for patients or the medical professions in the field of rare diseases, and we feel a clinically led national centre for rare diseases which coordinates information and establishment of care pathways for patients is a subject that, you know, really it's basically a very urgent need, and it's, as I always say, the root. If we have that, at least it will help us enormously right across the board, all stakeholders, to get the information that we need and accelerate the process towards diagnosis and treatment. And we welcome the commitment by the Minister, which he made in Shannon on the 7th of March this year, just after Rare Disease Day, to say that rare diseases will be included in the clinical care programme. And we know that that's something that will require very specific need, so we're very grateful for that's actually happening. So looking at the strengths of the current system, we have a well-trained medical and paramedical staff. We have very committed people in healthcare who want to provide the quality services. We have very, very active patient groups, very well linked, working very well together. The Genetics Rare Disorders Organisation, Irish Platform for Patients Organisation, Science and Industry, and the Medical Research Charities Group. We have very good linkages between our professionals actually at European level, and they're very well respected. We have major opportunities for epidemiological research with our population base and the high prevalence of genetic and rare disease that there appears to be in this country. So we also have a very strong pharma base for collaboration. The weaknesses, as you can see, are just a little bit longer, so you'll have to bear with me. Unfortunately, you know, the reality is that we have a major understaffing, major, you know, lack of resource, and lack of governance structures for the sustainability of national centres that may already exist. We have a lack of ring-fenced budgets and national funding, coupled with no health economics evaluation to illustrate where, you know, we could make cost savings and the benefits that would have. There's a lack of understanding and education of the public at large on rare diseases, and also people who are making decisions at local healthcare level, you know, they're not aware of the issues of rare diseases. We have no linkage of databases or registries, and lack of central office to coordinate activities. Like, for example, Orphanet. Orphanet is in every country. It's a fantastic portal which has all of the details on rare diseases, clinical trials, research, treatment options, and our Orphanet has been run out of Manchester because there was nowhere here in Ireland that it could be facilitated. So that's something that we're very keen to address. The research infrastructure in centres of expertise is very, very poor as well. And one issue that we're all, of course, very concerned with is the protected time for people to get involved in research. And research is imperative to the improvement of health for all people who are affected not only by rare disease but all conditions. There's also a lack of funded programme for trainees in the area of rare diseases and genetics. And this is a very important area. I mean, it is possible that we're looking to the future of having absolutely no clinical geneticists in this country, and it's an area that we really need to be concerned about now for the future. So a lot to discuss. You know, it's a broad area, as I've said, and just to give you an introduction, my name is Avril, and I was the chair of the group. I'm the chair of the Genetic and Rare Disorders Organisation, CEO of Fighting Blindness, and I also represent Ireland on the European Organisation for Rare Diseases. Professor Eileen Tracy, who's a consultant at the National Centre of Inherited Metabolic Disorders and Children's University and Mater Misericordiae Hospital, was also on the group, and Dr. Deirdre Mulholland, who's Head of Standards and Methodologies at HICWA. We consulted with Professor Philip Main, who's the Director of the National Newborn Screening Programme, Dr. Sally Ann Lynch, who's consultant with the National Centre of Medical Genetics, also Dr. Harinder Gill and Jackie Turner, who are also at the National Centre for Medical Genetics, Kitty O'Connor, who's CEO of Alpha One, Anne Lawler, who's the chair and a person who is a parent of a child with 22q11, and Ms. Sheehan O'Neill, who's with Shire Pharmaceuticals. We consulted with the European Organisation of Rare Diseases and the European Committee of Experts on Rare Diseases, and Dr. Segaline Aimé, who is the person who's instrumental behind Orphanet, and also with our task force. And our task force was made up of Gerdo, MRCG and EPOSI. So within that group, there was a representative of all stakeholders. But really the most important thing is to consult with you, to consult with everybody. What the Irish plan will look like in reality will depend on a number of factors, but we know that it will depend on financial support. We know examining other national plans in other countries, for example, France is going into its second national plan. There's national plans in Italy, Spain, Malta, Cyprus, Bulgaria. You know, the plans are out there, Denmark, and they're showing good value for money. It's a sensible thing to implement a national plan for rare diseases. You know, the organisation of this event was really to give you a platform to hear your voices and your opinions on the areas that are particular to you, that you have had experience in and want to see change. What we do feel as well is that next year is a very important year. Ireland will hold the presidency of the EU from January to June, and we feel that there's no area quite like rare diseases where you can see the added benefit of interaction from a European perspective for all the reasons that have been outlined. And so it's a very good opportunity for us as a country to show leadership in this area. So we feel now is the time to enact the many policies that have been developed at European level from the perspective of rare diseases to improve the quality of life for people living with rare diseases and to make it easier for those who are dispensing the information, the care and the treatment. So that's really where we're at. I'm very much looking forward to our workshops today and hearing from you, and also with the consultation going online. It's very important, and we're just very grateful that you're here today to participate. Thank you.